At 39th week of pregnancy, you should strictly look for following signs of labor, as your baby can decide to come any day now. Water breaking, diarrhea or nausea, loss of mucus plug, bloody show, tinged pink or brown-colored vaginal discharge. Once you notice bloody show, labor is just a day or two away. Be careful. If contractions last more than 30 seconds, coming around every 5 minutes, and do not stop, then it is time to call your doctor. And yes, make sure your hospital bag is packed. All the best. Stay tuned for next pregnancy videos.